planned. And the first presentation that we have will be done by my two fellow staff members, Dr. Justin Moore and Matt Tebow. And they're going to be talking about our benchmarking survey. This is the first benchmarking survey that we have done, and we're really excited about it. We'll be doing another one towards after the first quarter. But I think you'll find the benchmarking report pretty interesting. Each of our members should have received one of those in addition to our annual report in the mail last week. But anyway, I'm going to go ahead and turn it over to Dr. Moore, who is an endocrinologist who does consulting work at the clinical public health intersection with double arrow metabolism, and also Matt Tebow, who is our project director. Matt also manages 2 federal grants through the Centers for Disease Control, the CDC, around the prevention and management of diabetes, hypertension, and dyslipidemia. And Dr. Moore also works in that project, and I also work in the project a little bit as well. So with that, I'm going to go ahead and turn it over to you, Dr. Moore and Matt. Thank you.
Great. Well, thank you, Shelley. And I just want to welcome everybody as and echo all of Shelley's comments. It's really pretty wild to believe that this time last year at the Innovation Summit, we were shaking hands and giving each other hugs and sitting at tables with each other and talking without masks on. It's just almost a different world to believe that we lived in. But we're so glad to be here. We're so glad to have you here with us at the Innovation Summit this year. We are really, really excited to share with you the results of our first annual benchmarking survey. Dr. Moore is going to go into more detail about the survey, but before he got into the data specifics, I wanted to take just a few minutes to share with you all the process of why we decided to benchmarking initiative and then sort of our process to get where we are today. So as everybody in here knows, the value of data is so incredibly huge. If we have proper data, it can help us to gauge where we're at. It can help us to identify opportunities and possibilities, and it can also provide us direction. So another example about how we use data in a similar way is think about when we're buying a used car. So most of us, I think when we go to buy a used car, we go to look at Kelley Blue Book to see what information they have about the car that we're trying to buy. So Kelley Blue Book will give us information such as what the value of that car is. It'll tell us how the condition of that car determines the value of the car that we're looking to buy. And then also what the value of that car is in our region or your community, because the price will vary depending on where you buy it in the country. And so similar to that, we wanted to offer data that would allow employers to be able to gauge and where they at in comparison to other peer employers of theirs as it relates to their benchmarking data. So while all benchmarking data is valuable, and really any data that you can get is valuable, we really thought that having hyper-localized data on our employers within our community was even more valuable. So the benchmarking survey that you'll see and the results that you'll have here are the result of local employers contributing their data to this survey. And we hope that it's valuable to you, and we hope that you can find interesting insights from this data. As the Kansas Business Group on Health, we hope to provide further value to this data by being able to show, after multiple years, trends in what we see in benefit plan design and strategies, and hopefully ultimately costs. What it will also allow us to do is be able to determine the effectiveness of any initiatives that are rolled out either as part of the Kansas Business Group on Health or that are done individually by any organization within the business group. So for example, if an employer rolls out an innovative new pharmacy program or a chronic disease management or prevention program, and that reflects or produces cost savings, we hope that would be reflected in the benchmarking data, that we could then identify those strategies and then disseminate those with you, our members, and others in the community. So back in 2019 is when we decided that we'd like to start the benchmarking initiative in 2020. And knowing that we had that timeline, we wanted to bring in somebody that had experience and expertise to help guide us along this process. So for those of you that joined us for the Innovation Summit in 2020, you'll remember that Chris Ski, who's the leader of a sister coalition of ours down in Houston, came and shared the process that they go through for the benchmarking survey down in Houston. And he also shared some of the value that their employers and their coalition have received from that benchmarking data. Once we sort of laid the groundwork with Chris's presentation to give an understanding of how the benchmarking process would work and the value that we'd hope out of it, we began crafting our benchmarking survey and the questions that would go in there. So we are lucky to have assistance and guidance from our HR-led advisory council made up of members of the Kansas Business Group on Health that really helped us to devise our questions and refine and revise them to make sure that the data that we were trying to obtain from this survey was interesting to you as employers, it would resonate to you as employers, and hopefully it would provide value to you as you're planning your employee benefit and insurance design strategies. So once we had the survey created, we released it at sometime after the beginning of Q2 of 2020. And of course, we all know what happened after the beginning of second quarter of 2020, but we had really pretty good feedback and participation in the survey, especially for our first year. As part of our process for this, we did send it to both members and non-members. So our thinking with this was that we wanted to see how the strategies and trends and ultimately costs of employers who are not members of the Kansas Business Group on Health compared to those who are members of the KBGH. We thought this process was so valuable, and we thought the data that we would get out of this would be so valuable that we really wanted to encourage participation in the survey. So we did offer a incentive to any employer who was willing to complete the survey last year of 10% of their membership dues in 2020, whether you're an existing member or could apply that if you were a new member. So again, we had great participation in the feedback. As you'll see in the survey, we had 65% of our employer members respond to the survey. Well, it was really, really great, especially for it being the first year. Once we had collected all of the responses from the survey, we compiled them in an aggregate form as to be sure not to share any individual or organization specific level data, but just as the aggregate data as a whole. And while the value from this benchmarking survey is largely being able to see what local employers, your local peers are doing with their benefit design, we still wanted to tie it to a national benchmark so we could see how our employers here compared with those of the national benchmark. So we sought out a national survey of a similar kind, and we found the Kaiser Family Foundation annual employer survey, benchmarking survey that they do. And we found that the questions were a lot of times very similar. And so whenever we could, we tied the data that we obtained from our survey and matched it to that of the data results in the Kaiser Family Foundation survey. Going forward, we do plan to repeat this process annually. So we'll continue to work with our advisory council to refine the survey, add any questions that we think would be relevant and would resonate with you as employers, and then send the survey out each year. And then again, hopefully to show trend over the data over the course of several years. So with that background, I want to turn it over to Dr. Moore, who's going to go into more detail about some of the data in the survey, some data points that he thought were interesting and were potentially actionable by you, the employers. So without further ado, I will turn it over to Dr. Moore.
Thanks, Matt. I'm going to share my screen here. And I don't, do we have a quiz, Matt, to share or not?
Yes, that should be showing now.
Okay, so compared to the national average, as defined by KFF, as Matt said, KBGH members' participation in worksite wellness programs is far above the national average, at about the national average, far below the national average, or no KBGH members offer wellness programs. And we'll give you just a minute to respond. We seem to have hit a plateau at 66% of people vote. Is there 70%? And so I hope everyone can see that. The consensus of the group was that we're at about the national average. So we'll cover that in just a minute. And I'm going to close out of that if that's okay. And go to full screen here. Hang on just a second. There we go. So what I want people to take note of here is that we are a diverse coalition. We see that of the 2/3 of our members that responded, we range from 21 covered lives all the way up to almost 8,000 covered lives. And we happen to think that that is a strength. And we really appreciate the high response rate from the group this year. We hope to get that up close to 100% with subsequent years. So on this page, what I want to point out to you is on the top left, where we ask, is your organization fully insured or self-insured? In general, we believe that self-insured folks have some opportunities for cost savings and for data collection that fully insured folks don't. So we see this as an opportunity that roughly 2/3 of our membership, at least respondents, are still fully insured. We have products that we think could nudge folks toward being self-insured and potentially save money. Below that, we see that if you're fully insured, the predominant insurance carrier is Blue Cross Blue Shield. That comes as a surprise to no one. They're kind of the predominant carrier in a lot of ways locally. And below that, we see that if you're self-insured, the plurality of respondents used Medova as their third-party administrator. At the top right of the screen, you'll see that we have membership with a diverse set of brokerages, with IMA kind of eking out the lead. But below that, in terms of pharmacy benefit managers, kind of a surprising outcome to me, in that none of the big three nationally of CVS, Optum, and Express Scripts are really dominant. You see CVS and Optum down there toward the bottom, but Prime Therapeutics, MedTrack RX, and Blue Cross Blue Shield are the more common PBMs locally. In terms of plans and contributions, at the top left of the screen, you'll see that Wichita is a little more enthusiastic for PPOs and high deductible plans than what you see in the Kaiser data. We also have one respondent using a value-based health plan. And we see below that, in terms of employee contributions, that in general, the respondents to this survey tend to cost shift a little more of the premium expense onto employees than we see for national data. And if you look at the bars on the right, the black bars being family plans, Wichita roughly doubles the national average in terms of the employee contribution to their premiums. In terms of deductibles and out of pockets, again, the deductibles that employer plans have are roughly at the national average. No big surprises there. And out of pocket maximums are also roughly at the national average. The out of pocket obviously being the deductible plus coinsurance plus co-payments. So we are just sort of right at the national average on these things. In terms of co-pays and HSA contributions, our primary care co-pays that you see right at the top of the screen in the center are really pretty similar to national data, as are specialist co-pays right below that. Not surprisingly, emergency department co-pays are very, very high in our membership, which is, more or less the industry standard. But what really surprises on this page is down at the bottom left, the question of, does your organization make annual contributions to an HSA, FSA, or HRA? And you see that of our 15 employer members that responded, 14 reported that they made no contributions at all, whereas nationally, in the Kaiser data set, about half of employers contribute to one of those flexible spending accounts or health savings accounts. So again, this may be an opportunity, and we'll talk about that more in just a second. And it may be, a real opportunity when combined with the fairly large out-of-pocket maximums that we see locally. In terms of tracking health and wellness among our employee populations, you see along the left side of this screen that roughly a quarter of respondents to our survey tracked at least one specific condition, and about a third offered a specific program for one or more of those conditions. On the top right part of this slide, you see that bariatric surgery and infertility treatments are covered at modest rates, which is no surprise. That kind of matches national data. But even before the pandemic, we had pretty generous coverage of primary care telemedicine amongst our membership. Below that, you see the answer to our quiz question earlier. Does your organization offer a wellness program? And you see nationally about 2/3 of employers offer some kind of wellness program. Our membership, at least the respondents to the survey, were well above that at almost 86% offering a wellness program. And most of them had been offering it for quite a while, at least 3 to 5 years or longer. And so here's the big question that kind of ended the survey. That is, how much was your organization's total combined medical and pharmacy spend for the previous year? And interestingly, about 10 of employers that responded could detail their annual costs, and you see the results there. And these really aren't bad. Remember, if you take all comers in America, the average per capita healthcare spend is right at about $10,000. So our membership spends, at least the people who could respond, spend significantly less than that. But it's interesting that 6 of our respondents could not or would not detail those costs. So again, that's a potential opportunity for us to help out. So to wrap this up over the next few minutes, the opportunities that I see here coming out of this survey are that, one, as we said, we have relatively few self-insured employers, and I understand why that is. We have a diverse membership with several fairly small employers, and there may be some real intimidation in terms of the thought of taking on that kind of risk, but I think we could help with that. The second opportunity that I see potentially is that since we're kind of far behind national data on HSA contributions, and we know that people that carry an HSA are more likely to seek out primary care, which is the most cost-effective of all medical care, there may be an opportunity to take some of the money that we're currently spending on wellness programs and shift that over toward HSA contributions. We're generally optimistic about the future of wellness programs, but the data that's come out in the last couple of years has shown that as they exist now, they tend to be kind of disappointing in terms of actually improving health or saving healthcare dollars. And then finally, as I said, I think there's an opportunity to help one another out in really trying to nail down what it is that we're spending our healthcare dollars on and what kind of results we're getting as a result of that healthcare spend, as Matt said before. So with that, I'll shut up for a minute and see if anyone has any questions about this.
I am seeing no questions in the chat box. Does anybody have any questions for us today? If not, one of the things I wondered if either of you or both of you could talk a little bit more about kind of what you were just talking about, Dr. Moore, relative to wellness programs. And I know that we have at least one member that, spent quite a significant amount of money on wellness programs, and they were not seeing any change in their healthcare. Well, their healthcare costs kept going up. And so I think they've converted some of that funding into, using that in other ways. So anyway, I just thought if either of you could touch on kind of the national perspective on wellness programs. I think it has been very prevalent here in the Midwest and certainly within our members, but any other insight into wellness programs? And I know that One of the services that we offer, which is Quizify. Quizify really focuses on health literacy. So any insight into any of that?
So I'm not trying to be terribly provocative here, because again, I long term, I tend to be fairly optimistic about the potential for wellness programs. I just don't think we've quite figured it out yet. But as they exist now, you know, and we all know kind of what they look like, we have pretty good randomized controlled trial data in studies lasting several years showing that employees neither feel better nor spend less money on their overall health care. So for the time being, my instinct here is to not necessarily get rid of wellness programs altogether, but to you know, limit the scope of them to potentially really high yield things like smoking cessation, and shift some of that money toward things like an FSA or HSA contribution that make primary care more accessible to the employees.
Well, you know, one of the things too that I think historically when we think about wellness, you know, we think about, oh, you know, points for going to a gym or things like that. But the other thing that I think we're hearing more about in terms of wellness are things like financial wellness and, you know, stress reduction and things like that, which I'm really excited to hear about. I've not seen any data on any of that, but I do think that, you know, when you think about stressors for, well, anyone, obviously finances can be a big stressor. And so I think that there are employers that are really beginning to focus more on financial wellness and helping people understand that. So I didn't know if you had any thoughts or, you know, feedback about that or any other kinds of wellness activities that could be considered in kind of the scope of wellness, but aren't as traditional, if that makes sense.
Sure. Matt, I think you had a comment.
I just wanted to add that I do think wellness programs can be done really well. And oftentimes the things that make the most impact aren't things that cost the most money. It's things that basically just kind of encourage the behaviors that you would like your employees to participate in. So while offering programs and smoking cessation are great tools to offer, sometimes offering free fruit in the break room and offering the ability to get away from your desk to take steps or get physical activity in during the day and providing an environment and a management support that allows you to do that. And then Shelley, like you mentioned, with the different facets of wellness, I mean, there are so many different components to well-being. And I know I'm preaching to the choir here as I see a lot of the folks that I've been able to interact with over the years through the Working Well Conference and the think tank through the Health and Wellness Coalition, to know that there's the financial portion, there's the mental health, there's physical health, there's community. And so there's all these different components of a well-being program that employers can integrate into their workforce to encourage the behaviors that they'd like to see, again, sometimes without little to no money.
So I'd like to comment on this because I've wondered about the quality of the wellness programs. As you know, even talking here, that most of the intervention is on the individual employee. And we've been really pushing the intervention being the work site and providing policies and an environment that makes it easier for people to be healthy. I mean, you've mentioned some of that, Matt, and if you had policies that required nutrition standards that you brought into your workspace, you would create an environment that makes it easier for people to eat healthy because it's available and it's there.
Yeah, Jeff, I like that observation. One of my favorite sort of little tidbits that's come out of the pandemic is from Jean Twenge. She's a psychologist at UC San Diego that studies burnout and kind of digital stuff. And one of her findings is that people have held up surprisingly well during the pandemic in terms of their relationship with their work site. And as far as she can tell, it's because they are getting more sleep now than they did before the pandemic. And that's because they are going to work via Zoom and they don't have to burn 45 minutes on a commute to and from work. So it's just this, it's the kind of environmental thing that's almost accidental that has, you know, given people some real kind of resilience to the overall, you know, otherwise devastating effects of the pandemic.
That's interesting, Dr. Moore, you say that. It reminds me of the National Alliance of Healthcare Purchaser Coalitions, their conference, I guess it was over a year ago by now, but one of the organizations that presented, and it was a very large organization from back east, and they really had a very specific program dedicated to sleep. And they had some really interesting outcomes in terms of, increased productivity. And I can't remember the name of the program, but I know there are programs out there that can be used and incorporated into benefit plans. I did have one question on chat, and I don't know that I had the answer, but I don't know, Matt, you may. Did the organization that had the wellness program I spoke of earlier give any information in terms of percentage of participation? I'm not remembering the percentage of participation. I don't know the percentage of participation on that. It was a sizable amount of money. One of the things I think, well, I don't have any data to support it, but oftentimes when you have wellness programs, for example, points to go to the gym and that kind of thing, you typically find that people who are already doing that are the ones that participate. People that really, that isn't, part of their lifestyle. There just has to be some, something between A and Z there. So, okay, then I do have an answer for that from the organization that I was talking about. Participation had waned over the years to less than 40% of employees, and participation dropped even further once certain awards had been achieved. So that's really, really interesting. So there is the answer to that question. Oh, okay. I got some feedback on some of, okay, that was to everyone. Mark, Prime Therapeutics is actually Blue Cross Blue Shield's PBM. And then again, from our employer we were speaking of earlier, participation was strong early in the wellness year. So obviously in the beginning of the wellness year, probably whatever your benefit plans year is, it drops significantly halfway through. That's kind of interesting too. You oftentimes, it reminds me of, if you belong to a gym, oftentimes after the first of the year, there's a lot of new people, and then as time goes on, they don't see them. So there's really more to it, I think, than just, the traditional, and I know that employers are being very creative now in terms of expanding wellness. Okay, and then additionally, from our employer, chronic health conditions were increasing along with BMIs over the 7-year duration of the program. So that's really, really fascinating. I think that probably you could do a little research project on that program alone and learn a whole lot from it. So go ahead.
Again, I think, when we talk about participation rates, we're talking about the employee as the intervention site. And we've been funding WorkWell Kansas for a number of years. And what we're finding is, even though we're pushing worksite wellness, it's still a hard thing to do. So if we've created environments where the healthy choice is available to them on an ongoing basis, participation happens all the time. For instance, when I used to eat lunch at the Kansas Leadership Center, we had nutrition standards. It ensured that I had a very healthy lunch every time I went over there and ate. I couldn't go over there and not have a healthy lunch because that was all that was available. So I mean, and the participation rate is almost, probably real high participate because it was cheap food. It was good food. So I just challenge people to think about, always we think about how we got to go to the gym. So that's outside of it. I mean, and there is some policy. I mean, we policies around providing dollars for gym participation and awards and those kinds of things. But clearly, the work sites have control over the environment. And if they really looked at creating an environment that makes it easier, and policies that make it easier for them to be healthy, then participation is going to be 100%, because your environment is what is your environment.
Yeah, right.
I think that's really valuable. That's a valuable reframing, Jeff. I appreciate it.
Jeff is with the Kansas Health Foundation, but yes, that's very true. One last comment, and then I think we're probably, unless we have more questions, and Mark, you put this to everyone, didn't see an option in the survey for reference-based pricing, open access plans, which most of your clients are on versus provider networks. Interesting. And just one quick last question, Matt and Dr. Moore, any insight into additions to the benchmarking survey that will be coming up? What can we get a tickler for, maybe what a couple of questions we may be looking at, because we will be expanding it year by year. We don't want it to, you know, have 500 questions on it, but.
Well, we did discover that we need to alter some of the language to more closely match the language in our comparator data set. So you may see some of the questions slightly change in that way. Matt, did you have any other additions that will?
We had a question on looking at quality. Do you look at quality when selecting what providers you include in your network? And then again, these are all questions that we'll run by our advisory council to make sure that they're meaningful, but that was one of the questions that we were looking at, is potentially one around quality. And I do just want to address Mark's comment there, his second comment about not having reference-based pricing. That none of the respondents had that, so we had an option to include that if they did have that, but apparently just none of the employers that submitted the survey results this time around were using that option. But Mark, if you have employers that are doing that, we encourage them to participate and submit their results so we can learn from them.